Welcome back to New Day Northwest. If you are a parent or caregiver of a child with special needs, you know that pediatric therapy is vital. From physical and occupational therapists to speech language, the bond between the provider, child, and their parent is crucial. Occupational therapist Ashley Lankford joins me now. Thank you for being here.
Thank you for having me.
And thank you for what you do every day. My first question is, tell me what pediatric therapy services are and what your specialty is.
Of course. Well, I'm super excited to be here. I love my job. I am, as you said, an occupational therapist. If you don't know what that is, you are in good company. An occupational therapist, when it comes to the pediatric population, essentially just helps kids do what they need to do in their everyday lives.
Okay.
That can look like playing, eating, interacting with peers, going to school, whatever it might be.
Yeah.
And of course, looking at the underlying factors that are making that hard, like visual motor integration, fine motor skills, social skills, whatever it might be.
Okay.
Our team is multidisciplinary, so we have PT and speech as well. Physical therapists really dive into the gross motor, so think crawling as a baby, walking, of course with those older kids, running, jumping, climbing on the playground, and speech, of course, speech and language, but they do so much more than that. Also cognition, swallowing, feeding, we really cover it all.
I really had no idea how many specialties there were. A friend of mine's son has apraxia, and so they've been working with a speech therapist for years because it does affect the ways, and it's so hard for parents, like you don't always know how it's diagnosed, right?
Totally.
And that's where y'all come in.
Absolutely. We really try to support parents and the whole family unit, right?
Yeah.
I mean, it's kids. We have to include the caregivers to have a successful therapeutic relationship.
Absolutely. Okay, so what ages are we talking here? Because I'm seeing like a tiny baby helmet. What are the ages?
Yes, we work with infants and young children. So we see a super wide variety of diagnoses and children. We actually have a NICU follow-up clinic. That's what's special about our clinic.
Wow.
Is we get to support the continuum of care.
Yeah.
So we are an outpatient clinic, but we communicate directly with the inpatient team. So NICU babes that are in our NICU, when they transition home, we can help with that transition.
And you check and make sure everything is going right.
Exactly.
That has got to be a huge weight off of so many new moms and dads and parents overall.
Yep.
So let's talk about what therapy specifically looks like at Swedish. Like, what do the services look like?
Totally. It would, of course, depend on the child, the age. Oh, yep, here you can see our beautiful pictures. I mean, we're working with kids, so we want to make it fun.
And pretty and light and colorful.
Exactly. This is our motor gym. We also have a sensory gym. We even have a ball pit. That is a fan favorite of the kids, as you would imagine.
I would imagine.
Just a plethora of resources to tackle those fine motor skills, gross motor skills, cognition, speech and language, whatever's going on with the kiddo.
If somebody is at home right now and says, you know what, I've always had a concern, like I don't know what it is, what are some of the conditions that you treat, and how does a parent kind of know when it's time to contact their doctor?
Totally. We see a super wide range. Some of the common diagnoses might be children on the autism spectrum, cerebral palsy, neurological differences, developmental delays, even social delays or sensory processing challenges. So just everything under the sun. If parents are concerned about their child,